Hello, Prednisone Warriors. It's Dr. Megan, the Prednisone Pharmacist. I'm here live on Facebook and YouTube, here to answer your prednisone questions. I've had a few come in, and before I start answering questions, I definitely want to share a very inspiring poem posted in the Prednisone support group. This was posted by Marissa, Prednisone Warrior Marissa, and this is what she shared. And it's a poem. This is how she described it, why she posted it. She said, "This morning, scrolling through Facebook, a post popped up with a poem from one of my all time favorite poets, Uli K. I'm not actually sure how to pronounce the name. I always find such comfort in her words, and this one seemed especially appropriate for all of us struggling with this prednisone situation we are enduring. Hope it provides some comfort and motivation." So, without further ado, here is the poem by Uli K called Bless You. As a prednisone warrior, bless you for staying gentle, for picking up the pieces and flying half broken, for looking for the stars in everyone's eyes, even the sad ones, especially those. Bless you for working through the hard stuff, for waking up every morning and allowing others to watch you heal so that they could feel a little less alone on their journey. Bless you for staying the course, for carving hope out of grief and kindness from emptiness. Bless you for rising above, for living small, for choosing your battles even when you knew you couldn't win them all. Bless you for shining your faith like a lantern on a hill, like 1,000 glowing fireflies, like a second chance at grace. For your willingness to walk alone, to be misunderstood, and to love anyways. Bless you for that. I'm not a poet, and so I can't come up with beautiful words like this, but I agree with Marissa that the words of Uli K, the poet, I find do apply very well to the situation of taking prednisone and not allowing the side effects to rule your life. To become a prednisone warrior, to fight back against the side effects that you can counteract. So there's some phrases in here that stood out to me. Bless you for staying gentle. Prednisone is making our personalities different. Prednisone actually hijacks our moods and artificially makes us feel either super awesome, like having euphoria and extra energy, or depressed and anxious, or furious. They call it the steroid psychosis or roid rage. And if you stay gentle while taking prednisone, that's a choice you're making that's directly fighting against what your drug is doing to you. That's amazing. And I highly praise anyone taking prednisone for the ability to stay gentle. Here's some other things. For picking up the pieces and flying half broken. Choosing to take prednisone is choosing to use a medication that is a huge blessing and incredibly harmful at the same time. It's choosing to make a deal with the devil, figuratively, because he always gets something. And that's the side effects. And so when you take prednisone, you are flying half broken. Half of you is working well because of the medication, and half of you is paying the price with the side effects. Okay. Bless you for working through the hard stuff. Oh, with prednisone and having a disease that makes you take prednisone, there's a lot of hard stuff. There's a lot of phone calls that you have to make to doctors to get a second opinion or to get the lab result or to get the help that you need. Working through the hard stuff is not easy. For waking up every morning and allowing others to watch you heal so they could feel a little less alone on their journey. When you share how you feel in the prednisone support group or in the comment section of my videos, other people are blessed by that because they don't feel as alone on their journey. They know someone else understands prednisone side effects, understands this journey that is to take prednisone, a poison that the dose makes the poison. And when it gets that high, it can be horrible. The side effects can be so toxic, so horrible. For those who are listening live, I invite you to drop your comments below, questions, any experiences you have with prednisone that you'd like to share that you want me to answer your questions about. Drop them below. I'll keep going about this beautiful poem. So this bless you poem. Bless you for staying the course. When you take prednisone, it is so hard because for me at least, when I stayed the course and actually kept taking the medication that my doctor was prescribing, I didn't want to do it because the side effects were so horrible. For me, it was like, which is worse, the side effects of prednisone or the risk of my disease? It was a hard toss up. It was really hard the longer I was on it and the less prednisone helped. And so for staying the course anyway, for following your doctor's instructions, communicating with your doctor, letting them know exactly what it's going through, what it feels like for you. For carving hope out of grief. That the grief of getting a chronic disease diagnosis and being forced to take prednisone, there is definitely grief there. But there is hope. Like there's this amazing medication, prednisone, that can help you. It truly is amazing. For choosing your battles even when you knew you couldn't win them all. Bless you for that. That one makes me think of the spoon theory. Has anybody heard of the spoon theory? The spoon theory is that a person on any day is given a certain number of spoons that they can use to spend. And each spoon represents the amount of energy and effort it's going to take to do something. And so, for example, getting dressed might take a spoon. Taking a shower might take 3, 5, 10 spoons. Making dinner might take a spoon. Going to the doctor and driving home might take 2 spoons. The price you have to pay as far as energy, motivation, health in order to do something, to do a thing, right? And the idea with the spoon theory is that when you are chronically ill or you have a disease that you have to deal with, that most likely, if you're listening to this, you're taking prednisone for, you only have a certain number of spoons. When you had your good health in your youth, you might have 20 spoons in a day to spend. And so you could go and do all the things with all the people and stay up late and burn the midnight oil, and it was okay. But if you're taking prednisone and you have something that's making it hard for you, maybe you only have 5 spoons for the day. And so the first one you spent on getting dressed, and the second one you spent on driving to the doctor, and the third one on driving home from the doctor, and the fourth one was just feeding yourself a meal. And now you have 1 spoon left. What are you going to spend it on? Are you going to spend it on helping someone else? Are you going to spend it on preparing healthy food for another day? Are you going to spend it going grocery shopping? Are you going to spend it cleaning your house? Like you only have 1 tiny piece of energy left. Choosing what to spend it on is so hard because there's not much of you left to give. And so, for choosing your battles, even when you knew you couldn't win them all, when you're taking prednisone, there's a lot of battles. And so, purposefully choosing, okay, this is what I'm going to spend those few spoons on is powerful. And then the last one I wanted to talk about is to be misunderstood and to love anyways. A lot of people who take prednisone have family members, coworkers, friends who have no idea what they're going through. Um, Either you don't mention that you're taking prednisone or they just have no concept for what it's like to deal with the side effects of a drug. I've had lots of people say, I wish you could tell my family, fill in the blank. And so to be misunderstood, by the way prednisone is changing your body and to love your family and friends and coworkers anyway is powerful. Um, some of the things people wish their family members understood and knew include that the drug changes our personality. I've already mentioned this, but prednisone changes personalities. And normally you might be a happy, cheerful, kind person, but prednisone takes your long fuse of patience and shortens it. And you have less ability to deal with conflict and tough times. And so it's really hard to keep that patience, to keep that love anyway. So that's the first thing is the prednisone is changing personalities. Second, prednisone changes your ability to use food normally. Your metabolism is totally changed by prednisone. So it the way you're eating, like what you crave changes. The way you use the food that you actually do eat changes. The way your body moves around the food that it's already absorbed a long time ago changes. Your body puts fat on your face, making moon face, and your belly and maybe the back of your neck is a buffalo hump. And it's not flattering. It's not happy. You don't want to pose for family pictures, right? At least I didn't. And it's hard. You're not yourself. And the hard thing about prednisone is often people are stuck on it for so long. Okay. We've got a great question from Sebastian. I'm going to see if I can be fancy. All right. Oh, check it out. Sebastian on YouTube says, how long does it take to grow muscle again after discontinuing prednisone? Fantastic question, Sebastian. So let's talk about prednisone and muscles. So just barely mentioned that prednisone is changing metabolism. And one of the things prednisone is doing is depleting muscles, is using up the muscle mass and redistributing that throughout the body. So the reason this happens is because prednisone is mimicking our body's naturally occurring hormone called cortisol. Cortisol, Mother Nature has to help us survive disasters like famines, war, a really horrible divorce, things like that. It helps us to get through that time. And if there's a war or a famine, Mother Nature just wants you to get to somewhere safe where there's food, right? And so whatever it takes to get you there, Mother Nature doesn't care because if you're going to die in that war or you're going to die of the famine, like your long-term health is irrelevant if you don't get the help you need right now. Like we are using up your body's savings account to survive the disaster. And so your body's savings account are your muscles, your fat deposits throughout your body, nutrients in your liver. Those are all places your body is storing nutrients for when it is going to be a problem. And now, when you're taking prednisone, you're taking multiples of what naturally occurs. Cortisol is normally around 2.5 milligrams prednisone equivalent per day. And people are taking 20, 40, 60, or more milligrams of prednisone per day. So that's 10, 20, 100 times more prednisone than your body normally would be making in cortisol equivalent. And that means the withdrawal from your muscles is even more dramatic. I remember looking down and realizing, oh my goodness, my legs and arms are so skinny. I couldn't believe it because my belly was huge. My face was round. It was so depressing. Someone described it as feeling like a watermelon with toothpick arms and legs. I think that's the best description ever. And so now that we've established that prednisone does make the muscle deplete, it is legitimately stealing the proteins and the other nutrients there and turning them into other things. So Mother Nature would be taking those proteins and sending them to the liver and helping you use them up as energy because if you're not eating, you're just using up anything you can in your body and converting it to glucose so that you can have the energy to run away, right? So now you don't have muscle. How long does it take to grow muscle again after discontinuing prednisone? So I wish I had a precise answer for this, Sebastian, that They had done, like, these perfect studies that if you took 20 milligrams a day for 5 days and it had taken this much muscle away, then it would take you precisely 15 days to grow it back. Nobody's ever done a study like that. Or if you take, prednisone 20 for 5 months, then it will take, 5 months to grow it back. No one's ever done a study like that, unfortunately. That's the really hard part about prednisone is that it's such an old drug. There's no um, drug company that has the budget or the desire to study it and find out answers to these questions for like this. So there's no like definite answer, unfortunately. But what we do know is that the lower the dose of prednisone, the less muscle loss. And then once you're off prednisone, it does come back. Like this is not permanent damage. This is something that will come back. And so depends on your condition, but for a lot of people, you can be doing things to maintain it while you're taking prednisone. So you really have to talk to your doctor to make sure. Because my doctor was like, no, you're not allowed to do exercise. You could bleed to death. That's what I was taking it for. So it all depends on your situation, your doctor, your relationship, your health. But a lot of people should be doing exercise. You can do weightlifting, most people. Um, I wouldn't go like really hardcore unless you are already used to that and already have the tolerance for it. I would start out slow and gentle and build up to your ability to um, have muscle strengthening exercises, but uh, lifting weights, super important. At the very minimum, walking every day, definitely. And then supporting your body with good nutrition. So eating a high protein diet, really important. Um, by minimizing the amount of simple carbs, that'll really help support your muscles. And then yeah, there's no perfect answer, but it does come back. It can come back. Depends on your age and what you do to make it come back, but it can and should come back. Okay, let's see. More questions. Okay. So, Lorraine asks, my hair is falling out. Will it grow back? Really great question. So, prednisone can cause hair loss. This isn't a well documented side effect of prednisone. I'm actually one of the first people to find it and attribute it. But not just prednisone, but even inhalers, steroid inhalers can cause hair loss. And what it often does is it triggers a certain phase of hair growth to change. It's the telogen phase or telogen phase, depending on if you learned your science in Britain or not. um, and it just kind of stops the hair cycle, essentially. And this can happen in periods of extreme stress. And so, my theory is that since prednisone is our stress hormone, that for some people, that extreme stress, even though it's actually just prednisone, or maybe it's the disease itself, the extreme stress of that can make your hair cycles change and cause you to dramatically lose a lot of hair. It's not like chemotherapy hair loss where you'll lose an entire lock of hair, right? It's more of a hair thinning. When I personally experience this, I normally don't need to clean out my hairbrush like more than once a month because I just don't lose that much hair. And I had a full hairbrush full of hair to clean every time I brushed my hair. Um, it was really depressing. Before prednisone, my hair was super thick and like people would stop me on the street. Is that real? Like, do you really have that much hair? Yeah, I really had that much hair. In elementary school, people were like, "You have a lion's mane." After recess, my hair would kind of go poof all the way around my hair, all around my face. And so when I took prednisone, I took it from October till June, and then my hair started falling out in August. And I was like, "What is happening?" And then I discovered it was a side effect of like going off of prednisone. And then, so in August, it started falling out. And then I didn't notice hair growing back until about January. And then I remember going to my grandmother's funeral in like the beginning of March. And I remember having about that much hair growth, just a little curl right here. It was so funny. I felt like the little poem, like a little girl with a curl right in the middle of her forehead. It was really silly. So, yeah, the hair loss is real and it definitely happens. So then Lorraine's next question is, my body has redistributed fat in my body. Will I be normal again? I'm on prednisone, weaning off, but 2 milligrams a day for 30 days, then just one pill for 30 days, then off. Total months, 8 months of prednisone for PMR. So if your body has redistributed body fat, will you be normal again? Yes. When? Again, with the protein, muscles. I don't know. It's different for every person. And the studies we've done, and by we, I mean not me, that have been done by scientists, um, don't give a very clear answer for this. Um, but it does change. Does the body fat immediately redistribute? No. Do you immediately lose weight? No. Do you have to be really careful with your eating and exercising? Yes. Um, but you will be normal again, whether it's in 3 months or 3 years. It all depends on your condition, the effort you're putting in, and your underlying health and, your lifestyle practice of what you're eating and how you're exercising. So it's definitely possible to be normal again. I took prednisone for a long time and my body is back to the way it was before prednisone. So it definitely happens. It's just every person is different and losing that weight is real. It's not easy. Okay. All right. Sebastian has another question. Will I ever get my hormones back to normal? I have been on very low doses the last 6 months, but my testosterone, sex drive, motivation, overall happiness have plummeted. Oh, yes. That is so miserable and real. And I'm a little too short for this. I'm going to grab something to sit on so I'm not too short. All right. That's a little better. All right. I'm high enough now. Okay. So 6 months of prednisone can definitely wreak havoc on testosterone levels. Definitely. There's documented side effects in men that low testosterone, low sperm count, low sex drive, all of those things definitely related to prednisone. And again, it's back to prednisone being like cortisol. It's just a few molecules different than cortisol. And cortisol is only a few molecules different than testosterone. And they're all in a cascade. They're called corticosteroids. They're all, I guess they're all steroids. They're all called steroids. Prednisone, cortisol, testosterone, and all the women hormones too. They're all steroid hormones. They all have a four cyclic ring structure that is really, really similar. And there's a few enzymes that will convert one to the other and back and forth. And so having prednisone on board can definitely affect your testosterone levels. And it will get back to normal, but there is no shame in having testosterone supplementation while on prednisone. None at all, because it's legitimately causing a depletion of this hormone. And so if you've been testing your testosterone levels, then definitely talk to your doctor and say, hey, can I get, androgel pump and just rub that on your body 2 times a day or once a day, depending on your prescription. Um, there's no shame in that. It'll help get your sex drive, motivation, overall happiness, muscle strength back. Like if you legitimately have low muscles, then getting enough, not too much, testosterone on board will really support you in that goal as well. Okay, we've got some Yeah, so, Sebastian, your next comment was, "I don't know if I've lost testosterone, but I don't feel like a man." G Get it tested. I mean, it's probably $100 or less to get your testosterone tested. Get it tested. Find out exactly what your levels are because it legitimately does this. Like, that is a real thing. Okay, here's another comment. G-Monk says, "Prednisone affects over 6,000 genes and downregulates collagen." Um, yes. This one textbook I read said prednisone and through cortisol affects two-thirds of genes. It's a humongous amount of effect that cortisol has on our body. It can change two-thirds of your DNA, whether it's upregulating the building of protein or downregulating how much protein is made or breaking down proteins. Whatever it is, prednisone can affect two-thirds of your DNA. And he says, "Can we ever be ourselves again?" Yes, you can be yourself again after taking prednisone or even while taking prednisone. It's all about getting the right nutrition and doing all the things you can to counteract the side effects. Is our connective tissues permanently destroyed, damaged? Okay, this is super good. So back to your talking about collagen and how it's damaging collagen. So prednisone definitely affects collagen. What is collagen? Collagen is a protein that connects things. You'll know collagen in the skin. Collagen's actually in the bones too. It's what's holding the calcium in place to help you have strong bones. And so when prednisone is also stealing calcium and collagen, it really leads to a dramatic loss in bone mass. And so is the connective tissue permanently destroyed? So it I think it depends on what you mean by connective tissues. So let's talk about collagen. All right. So the collagen in your skin, all right, that's keeping your skin strong, without wrinkles, elastic, that you can pull it and it goes back into place, that it doesn't tear, that it's thick enough to not have injuries. That collagen can change while on prednisone. So if you have a cream of another cortisol hormone, like hydrocortisone cream or other even more potent steroids, and you apply them on your skin, you apply them to your eyelid or you apply them other places, it will thin the skin by diminishing the collagen, right? One of the side effects of prednisone that is permanent is called striae, and it's stretch marks in the skin where the collagen fibers separate, essentially. There's so much loss of it that there's a stretch mark and it leaves like a red streak. And like when I had babies and was pregnant, I would get stretch marks and they don't really go away. For mine, they kind of faded and maybe got smaller as my skin went back to normal, but they're the damage is there. Same thing with prednisone, but maybe even worse. Some have said that the redness doesn't go away, that the stretching and then leaving the red streak, the striae, that doesn't go away. So that connective tissue damage is permanent. The stretch marks are permanent on the skin. And it's not even necessarily a stretch mark. It's like your body's not able to hold itself together well enough anymore. That stretch mark. Um, and then there's the connective tissue in your muscle and the connective tissue in each your joints and the connective tissue in your bones. And I know that the connective tissue in your bones, it does not just come back. Like the damage, the bone loss caused by prednisone from either the calcium, vitamin D, vitamin K, magnesium, potassium, and collagen loss does not just immediately recover. I have not seen the Kendrick Lamar halftime show. It sounds like I need to see this. Does it have something to do with prednisone, Sebastian? Um, so, as far as connective tissue being destroyed, it can be permanent, and I think it really depends on what part of the body that is it is permanent. The damage to the bones is permanent, the damage to the skin is permanent, but I'm not sure about joints. Theoretically, most joints are going to be fine. Prednisone has been shown to be like the joint damage from rheumatoid arthritis is actually slowed, stopped, and maybe even reversed by prednisone. Um, so I would say maybe the joints themselves, but I know for sure the skin and I know for sure the bones. That connective tissue damage is permanent. There are things you can do to help with the bones, like you can support your body with the right nutrition. For example, the doctors who prescribe prednisone the most recommend that people on prednisone take calcium and vitamin D to keep their bones strong. And I also recommend eating a high protein diet to keep the collagen and the right balance because you're losing it so fast. You need to be giving back even more than you would have before prednisone. And so that's why I created Nutrinized Zone. It has the nutrients you need for supporting bones with the calcium, vitamin D, vitamin K2, magnesium, potassium, and others. They're in there. Then it also has nutrients that help support your metabolism. For example, I've got chromium picolinate, 200 micrograms, that has been proven in studies. I can't say that my product has, but in studies, it has reversed diabetes caused by prednisone because prednisone is changing the way you use up glucose and the way you're responding to insulin. And you have to have chromium to have the right insulin and glucose metabolism. And so when your body is peeing out chromium, you have to be giving it back. And so that's why I've got it in here to help you support your metabolism while on prednisone. So you can get this at nutrinize.com or on Amazon, either way. And so you've got to be giving those back to minimize. All right, we have more questions. All right. Scotty says 62-year-old PMR sufferer. PMR stands for polymyalgia rheumatica, for those who don't know. My first pill was 20 milligrams. Within 15 minutes, I could feel changes. Took an hour nap, woke up, and I had a holy moment. The pain reduction was fast and extreme. Is that typical? You know what, Scotty? That is not typical for most people who take prednisone, but for people who have PMR, that is actually like a perfect definition of you clearly have PMR. Like if someone responds immediately to prednisone and there's a question, do you have PMR or don't? That immediate response to prednisone is like, oh, you clearly have PMR. That is one of the hallmark symptoms is effectiveness of steroid treatment. Is it working and is it working quickly? If it works this quickly, then wow, clearly you have PMR and clearly you need prednisone for a while. It all depends on what your doctor prescribes, but 20 milligrams might be a little much, actually. Some doctors say 15 milligrams could be enough to start on PMR. Who knows? It all depends on you and your doctor and testing to find the exact right dose for you. But what's important is that while your immediate reaction is great news, being on prednisone for PMR does not mean you will have an immediate ability to stop taking it. Most people who take prednisone for PMR will need to be on it for a long time. Most people, it's a year, sometimes 2 or 3. Some people will never get off of it for PMR. So make sure you're tapering so slowly and carefully. All right. Let's see. Back to G-Monk and collagen. I have had tendon weakening for months and lingering pain. So I thought it was most likely collagen suppression in tendons, bones, and myopathy. Doctors think I'm crazy that I've linked it to prednisone. I don't think you're crazy for linking it to prednisone. That is totally legitimate. Myopathy is a documented side effect. Collagen is clearly implicated in the side effects of prednisone. The changes to collagen are definite from prednisone. So The other tricky thing that could be complicating things is a lot of people take prednisone for collagen-related diseases, for diseases of messed up collagen, for lack of a better word. And so I don't know what is going on with you. I can't diagnose you over YouTube, but for some people, prednisone is saving them from their collagen destruction. There's like the collagen that's holding up your bone, I mean your nose, that like this super important structure holding open your nasal passages so you can breathe. For some people with these issues, they'll have this collapse and it will like sink in and they will not be able to use their nose properly and how we'll have other collagen destruction. So while prednisone could definitely be the source of this problem, I would also definitely look into other potential diagnoses. Like, get a second opinion if you're concerned about tendon and other destruction of collagen, because a lot of people who are forced to take prednisone are doing it because of their collagen related diseases. Okay. Doctors seem very protective over prednisone and it not causing side effects. Don't know why. Yeah, it's a tough thing because it's like, all right, you're prescribing prednisone to save somebody's life. And that is a huge service you're doing to that person. The fact that prednisone exists is truly a miracle. Like the people who got Nobel Prizes for identifying cortisol and finding prednisone and other oral and other steroids truly saved my life and many other people's like quality of life. It literally is one of the most amazing modern miracles of medicine. But the protective over prednisone, yeah, it's like, okay, yeah, I prescribed you the prednisone, but I don't want to take credit for the side effects. Like, I only want to take credit for the good effects. Maybe I don't know. Like, I don't know why either. And it's such a tough balance with prednisone. It's hard to find where it's a good benefit to risk and knowing whether it's worth it to take it. And so your doctor might be like, "Yeah, it's gonna do this and this and this good thing," but they might not mention this and this and this and this and this, all 150 side effects, right? Like, they might only do one or the other. So it's really tricky. Yeah, I agree that some doctors are very protective and don't. One more thing about doctors and prednisone. I mentioned a few minutes ago that prednisone is a super old drug. It was invented before my dad was even born, right? Like so long ago. And there's no drug company doing research about it. And it was approved before the kind of research that we expect now was even required. And so the studies just aren't there. And then the information that your doctor actually has access to about prednisone isn't the same. So I asked all of my pharmacist friends who had access to different pharmacy databases, right? One had access to Lexicomp, another had access to Micromedics, another had access to clinical pharmacology and UpToDate. Like all of these amazing paid subscription, expensive databases that have compiled all the best information. And so I expected that Lexicomp and Micromedics and UpToDate and clinical pharmacology would all say the exact same thing about prednisone. But I was super surprised to find that Lexicomp said this, Micromedics said this, and then UpToDate said this, and clinical pharmacology said this. The circles didn't quite overlap all the way. They had totally different lists of side effects. So if your doctor is only looking at Lexicomp, he's not seeing the whole picture. Like he doesn't know about all of these other possible side effects of prednisone. It's mind-blowing how poor the quality of the information is about prednisone. And so what I did is I took all of that information and I compiled it all into the ultimate list of prednisone side effects. Um, I'm gonna drop a link to that so you have that because it's the only place you can find all the side effects. The rest of them, it Like, those other databases your doctors are relying on aren't there. Like, okay, this link I just dropped shows the ultimate list of prednisone side effects because I compiled all of those different lists into one, and then I showed you how many of them mention the same thing. Actually, maybe I'll just even share this screen if I can figure that out. Not sure if I can figure that out. um, yeah, I have no idea how to do that. Okay, I'm gonna have to figure that out for next time. But on this page, I have a chart, a searchable chart, and you can see the category of the side effect. So, like the first one on here is fluid and electrolyte disturbances. And the name of that side effect is hypernatremia or sodium retention. And then the common name that I kind of translated medicalese into English so you can understand it it means prednisone causes you to retain salt. And then the next column I had called source. So the number of the side effect literature places that mention it. So there were 3 of them mentioned that prednisone causes retention of salt. But I had like, how many do I have? I had 8, 8 sources, and only 3 of them mention that. Here's one that is on here all over. Pretty much everybody mentioned it. Fluid and electrolyte disturbances again. And this one's called fluid retention or increased plasma volume or leg edema. So like swelling so much that your leg like gets bigger. And the common name for that is you're retaining water. And there were 5 of the databases that called that a side effect of prednisone. And some of them even gave more detail. They said that this is a common side effect and that it is common at higher doses. So I tried to consolidate all the information I could possibly find in here. But then there were things that only 1 or 2 of them would mention. So your doctor might not even know that collagen issues are a side effect of prednisone. That's what's mind blowing to me. Okay, let's see. G-Monk. Oops. G-Monk said, I took it for Bell's palsy, had no aches, and was very fit. Then my body transformed after 2 weeks, 60 milligram course, no taper. Oh, wow. You went from 60 milligrams to nothing. Whew. Wow. That is dramatic. Like, that is right on the edge of like, uh, 60 milligrams for 2 weeks straight and no taper. 2 weeks is the cutoff for when we need a taper. And so had you gone 1 more day, I would have been like, you absolutely must have a taper. But it's everybody's body that really determines whether you need a taper. And losing, feeling horrible after taking prednisone that high, like that is so high with no taper, like your body could be going through withdrawals too. Like that could be part of what you're going through. I don't know. It's horrible. And then the next thing G-Monk said is, I really believe healthcare doesn't know how to handle side effects. Yes. This is freeing seeing 7 doctors of various specialties. Wow. They don't. They don't know how to handle the side effects. They have no idea what's causing them. They have no idea what to do about them, and they're not even looking for them. And that's what's really hard is, I told you that the doctors who prescribe prednisone the most came up with a guideline that all doctors who prescribe prednisone are supposed to be following, and it's called the glucocorticoid-induced osteoporosis guideline. And it talks about how you should be taking calcium and vitamin D, and then with your vitamin D, you're supposed to be having your blood levels checked. And they're supposed to be recommending you stop drinking, stop smoking, and you're supposed to be exercising and eating a low fat diet and all this stuff. And I'm like, low fat diet? No. But the principle is doctors should be telling you all the things to be doing. And in the 15 minutes that their bosses are giving them to talk to you, it's not enough to cover all of that. Like they barely have enough time to even hear what your problem is, let alone propose a solution, right? And so that's exactly why I have my prednisone checklist, because on my prednisone checklist, I go through all of the science of exactly what you need to know and I outline it for you. Like you don't have to think about it. You just follow my checklist, get the things checked that need to be checked, and it makes your life a lot easier to not have to worry about it. Here's the link to the prednisone checklist. So you know, okay, I'm checking my heart, I'm checking my eyes, I'm checking this, I'm checking that, I'm checking that. I'm giving back this, I'm minimizing this, I'm avoiding this. I go through all the things you need to be doing. So just get my prednisone checklist so that you know exactly what to do. Okay. All right. Tekken says, "Hi, Megan. Just dropping in to say hi. Thanks for your advice last year. It really helped me so much. I've even stopped drinking since I finished my prednisone." Yeah, good work. It's crazy that recent research shows that drinking alcohol can increase your risk for cancer. That was mind blowing. But for people on prednisone, alcohol can make your side effects worse, make your weight gain worse, make your adrenal suppression worse, make your bone loss worse, make your heart complications worse. So everybody on prednisone should be avoiding alcohol while on prednisone. But that's awesome. You doing it since stopping. Okay, and that is UK healthcare for you. It's American healthcare too. Still recovering after 10 months. Okay, more from Tekken. I'm in London. They didn't give me any advice at all until I found Dr. Megan's YouTube page. Thank you. I'm glad that you found some help here. All they told me was to take it in the morning with breakfast. All right. So I want to talk about how to take prednisone best. Let's talk about the best way to take prednisone. And I agree with taking it in the morning. And I personally think that the most strategic way to take prednisone to be the closest to mimicking Mother Nature's cortisol is to keep it right next to your bed. Keep your prednisone pill bottle and a glass of water right next to your bed. And literally the moment you roll out of bed, or even while you're still in bed, take your prednisone pill right then. Don't worry about making breakfast and getting dressed and all the things first. Do it the very first thing you do for the day. That's what I think. Is there food involved in this? No, there isn't. Unless you're taking prednisone with ibuprofen, naproxen, or another NSAID, non-steroidal anti-inflammatory drug, taking prednisone with food may not be necessary because prednisone and an NSAID causes a drug interaction that is really, really bad for your gut and can lead to ulcers and other problems. And that's why the typical advice was take prednisone with breakfast, like with food. But recent research shows that you may not need to take it with food. Like if you're on a fasting, intermittent fasting diet and you're like, I don't want to eat breakfast until noon, then don't take your prednisone the moment you wake up and then don't eat until noon. Like talk to your doctor about it, talk to your nutritionist, make sure everybody's on board with it. But you want prednisone to be there. And the reason is because prednisone is mimicking our body's cortisol, and cortisol normally is secreted by your body in this beautiful rhythm that is highest right before dawn. It's high, like your body starts secreting it right before dawn, and it helps you give you the energy to wake up. It's kind of like the switch that turns your whole engine on for the day. And so if you're taking it first thing in the morning, it's mimicking the way you are used to having it, helping you have the energy to go throughout your day and do all the things. Okay. Yeah, so you can take it with breakfast. And if it's making you have a hard time eating, like if you're having gastrointestinal issues with prednisone, then definitely take it with food. But maybe just have a cracker next to your bed instead. Okay. Scotty says 30 days, 2010, then cold turkey. Been 2 weeks with no pills. I don't seem to have side effects. Am I missing something? No, that's awesome. That's a taper. Going 2010, that's a taper. Like you went down. So that's okay. And it's only 30 days. You might be okay, you might not be. Like if you're not having symptoms, side effects, fantastic. Then it's fine for you. Like some people can handle it, other people can't. If you're having symptoms like you feel like you're getting the flu or something, that would be a problem. But if not, and you're welcome for posting them. And then Tekken says, I've even been telling my GPs about you and everyone else. Thank you. I really appreciate you sharing, that this information is available, that there is help and hope while taking prednisone. Okay. And then back to taking it in the morning. They said take it in the morning. You might feel like you have some extra energy. No care advice at all or follow up. Yeah, you might have extra energy. Some people like have this amazing euphoria. I remember the first time I took it, I'm like, wow, I can like clean my whole house. This is awesome. And then it's like time to go to bed. I can't sleep. I still have all this extra energy. Anybody else feel that way? Okay. Tekken says, I put up signs in my house saying, you're on prednisone for the last 8 hours of the day. It had worn off. Yeah, it's okay. You're on prednisone. Remind yourself. That's why I'm feeling this way, right? That is a fantastic comment. Okay. I tapered off just like Scotty did 20, 15, 10, 5. Yeah, that's normal too. Logically, prednisone is 4 to 5 times stronger than natural cortisol. With a long half-life, that's 200 milligrams of cortisol per day, can't be safe. If it's taken for anything non-life threatening, we say stress is bad. Yeah. So prednisone is 2.5 times stronger than cortisol. Potentially. Depends on what you're measuring that it is stronger about. Is it for the anti-inflammatory benefit? Is it for the immunosuppressive benefit? Is it for the growth suppressive effect? And there's no perfect way to measure how much stronger it is. They've tried all of these different methods, but generally it's somewhere between 2 to 5 times stronger. Yeah, stress is not good for our bodies. All right. GMOX says, can you talk about iatrogenic Cushing's? I've read it can be worse than endogenous Cushing's. Will it resolve? Okay, so let's talk about what iatrogenic means and what endogenous means. So endogenous means it's coming from inside, like it's caused by something in your body. Iatrogenic means it's caused by something a healthcare person did to you. So iatrogenic means it happened in a hospital usually, or because of a prescription a doctor gave you or something. So Cushing's is a way of describing a constellation of symptoms that can happen. So they first noticed this in people who had pituitary tumors, and it was causing them to release too much cortisol. And so these people ended up with moon face, with muscle loss, with bone loss, with big fat bellies, and it eventually could kill them having so much cortisol and not enough of other hormones. The body was messed up in the way it was secreting hormones. So that's the endogenous Cushing's. And then when they started giving prednisone to people and other steroids, they noticed, wow, that looks just like Cushing's syndrome caused by, pituitary tumors or other issues. And so the Cushingoid like things that happen to people on prednisone are essentially the exact same thing. Like it is how your body responds to high cortisol, whether it's from your body making too much cortisol or it's you're taking too much cortisol as a pill. Like it's the same complication, the same symptoms. And it it matters to find out which one it is because if you have a pituitary tumor, they need to, get rid of the tumor, right? They need to do surgery and remove that tumor or get the other medications in place, other hormones that are being messed up. They need to fix those. So, as far as knowing which one it is really important that you know whether it is caused by your body or it's a side effect. For most people taking prednisone, it's a side effect. And if it's caused by prednisone, it will resolve. Yay. It's worse the higher the dose. So you're taking 60 milligrams. Basically, everybody will have some symptom of Cushing syndrome. Most people at that high of a dose for a long time will have moon face. Most people will gain weight. Most people will have those complications. Whereas most people who are lower, like the lower the dose, the smaller the moon face, the less weight gain, and you may even start losing weight the lower the dose you go. And once you stop taking prednisone and you fully recover from taking prednisone, those things should go away. The moon face should go away. The weight loss, you're going to have to work at it, but it should go away. The redistribution of fat, you should be able to redistribute it back to your muscles and things. It takes work, but it does go away. It will resolve. Okay. All right. So I'm not seeing any more questions. I'm not seeing any more questions. Any last second questions from anyone? Um, Let's see. I'm not seeing more questions. So thank you for joining me today for this live broadcast where people have asked questions to me, Dr. Megan, the prednisone pharmacist, all about prednisone and how to counteract the side effects. To be a prednisone warrior, if you missed the beginning, I highly recommend going back to the beginning where I read a very inspiring poem posted by a prednisone warrior all about keeping the right attitude while on prednisone. That bless you for taking it, for keeping a good attitude, for being a prednisone warrior while taking it. Signing off as Dr. Megan, your prednisone pharmacist. You're welcome, G Monk.